All right, you should be all set.
All right, so I'd like to welcome everyone to the Pathroot live stream. This is our family guide to addiction, where we bring folks on that can answer questions that are uppermost in people's minds, and also hear personal stories of how they're navigating the complexities of being a family that is struggling with someone that is a substance misuser or someone that is suffering from the disease of addiction. And so today we have a very interesting and hot topic to talk about, which is the maze of treatment options that's out there if your loved one needs to enter treatment. A lot of questions that surround this. I see this quite a bit on social media where people kind of don't know where to start, what's out there, and what their options are. So we're joined by Luke Caton, who is the CEO of Inovia Behavioral Health. He's also been a former treatment provider and has a deep wealth of knowledge about what's out there, how to help families, get in the right swim lane, and how to work through these treatment options. So, Luke, why don't you tell us a little bit about you, about Inovia, and then we'll get started.
All right. Hey, thanks, Carolyn. First of all, thanks for having me. And of course, thanks for doing this because I think you're right. There's such a huge need for families to be able to have those resources and not sure where to go. So hopefully we're able to help a little bit. Quick background on myself. I've worked in behavioral health space now for 25 years. I've been a treatment facility owner and operator, as you mentioned. And as a as a consultant, I helped dozens of other programs either start or grow their operations. One of those things along the way was working with helping connecting families to treatment as well, and vice versa, including some of their call centers and things like that, as far as navigating within their own systems. And really along the way, I became sort of what I call a skeptical advocate, meaning somebody who didn't want to continue doing the way things have always been done within the system, and how can we help support people in another fashion. And that's where Inovia came along. We're a membership-based organization that provides live support in group formats. So anything from health and wellness related groups to mental health and recovery related groups, and work and personal relationships, and really supporting people through different points in their lives and their changing needs along the way.
So why don't you give the audience a little understanding about how Inovia and its support system is different than what somebody might experience in AA, NA, or Al-Anon?
Sure, great question. So one of the things I mentioned, we do have recovery support groups, but with our recovery support groups, they're not specifically dogmatic at following a particular thing. Some of them could be, some of the facilitators may be 12-step advocates themselves. Some may just be general all recovery type groups. And really our thing too is, what do we do beyond that? Like at some point, a lot of times people need to actually stop talking about the addiction and stop talking about the drugs or the alcohol or the recovery thing, and getting on to what are the things in life that they're having challenges with that may be triggers, or that may be these other things. And let's focus on that and moving forward. So that's where the rest of really our groups are focused, is how do we move beyond this sort of circle that a lot of the recovery industry sort of stays in, which is keeping people in this holding pattern of identifying someone who may be incapable of getting past a certain point in their lives, where there's actually plenty of data to show that people can change even without going to treatment, just as much as they do if they go, but it depends on their severity often as well.
Yeah, I think the other difference is that there is, these are interactive sessions, meaning that people can share ideas, ask questions, hear from the moderator, versus typically in many AA, NA, or Al-Anon meetings, there's not crosstalk allowed. So people share their stories and you learn from that, but you're not exchanging ideas at that point in time. And I think that's a huge difference. So this is going to be a very broad question. And I actually happen to be one of these parents who really struggled navigating the treatment landscape. My daughter was addicted for 15 years before she overdosed and passed away. And I think we entered and exited at least 10 treatment programs. So it was very confusing to me. What do you think the biggest challenges or biggest questions that are burning in people's minds about, you know, when they think someone needs treatment, now what, dot, dot, dot?
Yeah. Yeah. Great question. Usually I'd say a couple things. One, the first thing is this going to be the one? You know, especially if they've been into treatment before. Is this going to be the one? Or we've tried something else before. Why is this one going to be different, or why is this going to work? And those are valid questions. I think it's important to look at those. What has been tried before, if anything, if this is a first attempt at treatment and somebody's willing to get help, or maybe they're requiring an intervention, what are some of the key components that are really having more of an effect long term, as opposed to just preying on that hyper acute situation where somebody needs to go now because it is such a serious life and death issue, that many of the treatment facilities know that, and so they're trying to get people to act now, like admit now, and they're bypassing that period of time where you can really evaluate if this is the right place for my loved one or not.
Yeah, and I think also too, what happens to families is that they wait too long to do their research. So in other words, you know, they're not sure whether they need to be in treatment. And then all of a sudden a crisis happens where it builds to a crisis, and then you're left to do it very quickly.
Mhm.
It's exactly as you said, you know, admit now and go into treatment. One of the things that people also struggle with is what are the types of treatments out there? So could you kind of define the continuum of treatment and what each one is designed to actually do?
Yeah, absolutely. So there's the ASAM criteria, the addiction, the Society for Addiction Medicine, and that goes through the various levels, and that's what insurance is built on. That's what medical necessity is used to really go through, and the highest levels of care are typically inpatient hospital care, detoxification, et cetera, going on down through residential treatment, which doesn't have quite as high of a medical requirement as inpatient hospital and detoxification. Then you go down to partial hospitalization, which is more of a full-time day treatment. Some facilities offer housing to go along with that or not. From there, it goes down into intensive outpatient, or IOP, and IOP is typically a half day, 3 hours per day, anywhere from 3 to 5 days per week. Below that is outpatient, which is much less, usually one or two times a week of interaction. And then at the bottom is some type of aftercare services and individual therapy.
Yeah, I want to move to rehab as a focus, because a lot of people think of treatment and they lump everything into rehab.
Mhm.
But before we do that, I'm going to talk a little bit about detoxification, because I saw a post just recently in one of the Facebook groups I participate in where someone tried to cold turkey off of alcohol and almost died from it. So talk about the medical necessity of not trying to quit cold turkey if you're very addicted, and what detoxification does in a safe way.
Yeah, great questions. This is where the doctor and clinical assessment is so critical to how long someone's been using, what substance or substances are they using, and are they a risk for potentially having a seizure or fatal risks through withdrawal. And there are, for example, outpatient detox for alcohol specifically. Even there are outpatient detox protocols where a doctor can do an assessment. If they deem it's okay, then they can prescribe a medication and wean someone off safely in an outpatient setting. Typically, they go to an inpatient detox setting where they're doing a similar thing, whether it's alcohol or opioids. Those are two of the most common there, but also benzodiazepines like anti-anxiety medications, Xanax, Klonopin, Valium, that type of thing. All these have potentially deadly withdrawal symptoms, and that's why in that case, it's best to have the clinical and medical advice from a qualified medical provider to go, hey, you really do need inpatient detoxification, or you really do need to be medically monitored. You can't just do withdrawal on your own process.
Yeah, I think that's really important for people to understand, that oftentimes, you know, what they think of treatment, which a lot of people classify into rehab, is preceded by detoxification, so you're not at risk of dying from just the actual withdrawal itself.
Yeah.
So let's talk about rehab, because that's what most people equate treatment to. Generally, it's the 30 days that you spend in an inpatient facility, and you're there because you kind of cascaded into a danger area where you have to do something more intense. What do you think the purpose of rehab is today? Like, how do rehab programs view themselves, and what should the purpose be?
Well, a lot of times what families are sold is that this is going to be your end solution. That we're gonna provide all that's necessary and give them hope that their loved one is now going to be magically okay at the end of their stay with them. And unfortunately, it's not the case for the majority of people who go into treatment. Um, there's much more involvement that needs to occur. It's a longer period process, and the initial parts, like after someone is medically safe through withdrawal or detox, then they go into typically the residential stay, like you talk about. That's really just more for stabilization. It's virtually impossible to take someone out of all the habits and environmental factors that they've been in for X number of years to go away for 30 days and then to magically come back and be okay. And that's really all it is. It's really to get them stabilized and set up for continuing on those lower level services as the continuum suggests. But also, how do you then set up the rest of the factors in their life, such as the family influences, the work influences, the other social influences? They call them like social determinants of health, or they'll do lots of different scales or variations of what are the other factors in someone's life. And really, those play more of an important role than the initial stabilization period.
Yeah, I think one thing that the public's not aware of, and I think this is an important statistic to bring out right now, is that according to government reports, whether it's Samsonite, you can look at any research report, and the relapse rate is generally at least 85% in the first year after treatment. Oftentimes within the first couple of months, people relapse. And so it would be like you going in and saying to your orthopedic surgeon, hey, I need knee surgery. And he says, great, Luke, I'm going to fix you right up. We're going to do all this surgery and then, but 30 days from now or 60 days from now, you're going to come back. I'm going to start that process all over again. So that's a statistic that people just don't understand.
Mm-hmm.
So would that to you indicate that the rehab process is probably broken at this point, not giving us an outcome?
Yeah. Outcomes measurement. They continue to have to come back to looking at, we have to measure outcomes and we have to set standards, because if what the system we're doing as a whole, we're working as a whole, then the statistics wouldn't be like you mentioned, and we wouldn't have had a record number of overdoses for 8 years running up until last year. Or I don't know if that's the exact one, but
through last year.
Yeah. And then I think finally started to dip slightly. But even that being the case, there's so many different ways of what people measure, how they measure, what success looks like. There's so many different factors involved that it's hard to place something on behavioral health and addiction specifically of this is what everybody should do, because there is no one size fits all. So you have to address the various components of living and incorporate that into treatment, not just treatment and that's the end, if that's the end point, if that makes sense.
So originally you said 30 days is not enough, and I would agree with that. Like, I think a lot of people get admitted into rehab. I agree that the rehab facilities often will say, you're at the end game, we're going to fix this problem. And we are all super relieved, like, oh yeah, finally we've got a fix for it, because we haven't been able to help fix it ourselves in the family environment. So go back to your days in treatment. What might you change in the treatment philosophy when they go into the stabilization process that would produce a different result than what it's producing today?
I think from day one, it's involving the stakeholders in terms of family members right away. And unfortunately, the system's set up for, due to confidentiality things and HIPAA compliance, that if somebody doesn't sign a release of information, then they're not going to get information on how their loved one is doing. And so what is happening inside the treatment center, what's communicated to the family members outside of treatment, may be two totally different things, or what's being communicated by the person in treatment, if they're communicating, and what's being communicated by the therapists or the family support system, et cetera, to the family members. A lot of that is swirling around and not actually meeting up in a centralized location, similar to when you're incorporating the treatment team, the doctor potentially who's been seeing that person their whole life and has more medical history and background information is not being included in the treatment team. The psychiatrist, if they're seeing one, they might have a pastor or somebody else important in their life, or their therapist outside of treatment. If you're not incorporating all these people into this and including obviously the person themselves who's going through treatment, then you're only addressing a piece of the puzzle. And then when they get released back into whatever environment, then the new people are going to pick up where they left off or what they think is going to be, but they're not going to be incorporating what happened in their treatment. So I think that's really where I would start, is getting everybody in on the same page from the beginning so that you're all moving forward in the same direction.
Yeah, and I think it's also very difficult in the environment treatment programs find themselves in today. Statistics, I believe I read this in behavioral health news, are that 40% of programs are not profitable. So they're struggling to find staff. They're struggling with profitability. So adding that component to focus on the family or incorporate the family is likely very difficult. But having said that, research also indicates that if you have an educated and involved family in the process, there's a 56% reduction in the overdose rate in year one, which is dramatic. It's a huge number versus the 85% relapse that we got. So I want to add to what you said. We actually have run a treatment program in North Carolina for 13 to 17-year-olds that were struggling with substance use disorder. And the two things that I would incorporate in treatment is exactly what you said. Find a way to educate the family and what their role is in recovery. You know, they've been engaged in behaviors that seem right for them at the time, you know, whether it's enabling the person financially, being codependent, trying to fix their problem. And all those things seem right at the time, but they're also counterintuitive to the actual recovery process. So they have to know what the disease is and what their role is. And the second thing that you alluded to, and I want to drill down on this in a minute, is creating a long-term plan. So 30 days, if you're not doing your planning about what does it look like after those 30 days, can the person come home or not? How does the home environment need to change? How do the family dynamics need to change? And then, you know, how to appropriately assist the person that's in recovery so that you're not overbearing, but you're supportive. So talk to me about, you know, somebody exiting rehab, if they're playing the long game, what are the other options they ought to think about that extends the treatment process so that we actually buy ourselves enough time to sustain a really long-term recovery?
Yeah, it's so essential. First is that built-in continuum now, which is going into partial hospitalization or full-time day treatment if time allows, or some type of intensive outpatient treatment, which that can continue on for 3 to 6 months in many cases, even sanctioned or covered by their insurance plans will still cover it because they're going part-time, but that allows them to start being able to get real-time help along the way while they're getting back to work or school or functioning in whatever capacity that they're doing, and still getting a more intensive experience, and then continuing down that shift. So I think there's a pattern that's available if people would follow it, but most don't actually continue through that process. They stop afterwards, or they might go to PHP for a little bit or IOP for a little bit, but then they don't connect up with a recovery coach or a therapist or some other coach or other peer support models for their specific needs, it continues to be this, well, go to meetings for 90 days, 90 meetings in 90 days and do that plus IOP and you're good to go. That's really not addressing it either. It's going back to, okay, well, how do we help them get a job? What kind of job is going to be conducive to their long-term, not just recovery, but improvements in life? What are the kind of relationships? Are they continuing to choose the same kind of person who drives them back into their old patterns and routines? Well, we need to take a look at relationship stuff more deeply, like lots of different things like that you can't solve in any short period of time.
I think a big challenge for a lot of people when they think about treatment is the expense of doing it and the battle that they might have to engage in with their insurance provider to get payment for that. So can you talk a little bit about, navigating the financial maze so that you're not going to go bankrupt when you're actually engaged in the treatment process?
Yeah. That's, one of the good things about treatment now is that it's easier to find quality programs closer by than it used to be. 10, 15, 20 years ago, there was a lot of destination rehabs, is what I call them. So you'd get on a plane, you'd fly somewhere and you'd go for 30 days or so, and then you'd come back and you're supposed to be magically good and you pay a ton of money, or if you had great out-of-network benefits, then it would cover most of it. And then treatment providers would just write off your copay, even though they're not supposed to. And they just bill it up, right? As long as you can be there. And really now there's a lot more options. It's much more about, if you realize that the first period is more about the stabilization period, and then having that time and breathing room to bring your team of support together and putting together a good long-term plan, then that's really what that time should be used, is to set you up on that path for success after that. And so that's what I would say. One is that when evaluating your treatment options, it's unless you really are sold on the fact that equine therapy is going to be the one thing that's going to be the difference maker for you in your life, and it may be for some people, or if you might think that EMDR versus DBT, and like throwing out all these things about types of what they call evidence-based practices. Every treatment center has evidence-based practices, but is it right for the person that they're looking for? And so if you're evaluating two different treatment programs, and one is in network, one is out of network, one only costs you $3,000 out of pocket, another one costs you $15,000 out of pocket, it's not always that the more expensive one is going to provide better treatment, especially from the mindset of the heavier work is actually done after you leave treatment, and that should be more of the focus. If you can afford those and have great benefits, then absolutely go to the one that's going to be most conducive, to someone wanting to participate and believing in the services that are offered and believing that it's going to set them up to have that chance. But it's not nearly as crucial as people think. It's much more that long tail.
Yeah, and also too, for the people out there that are listening that have Obamacare, the federal government passed an act called the Parity Act. And basically what the Parity Act says is that each state must treat medical and mental health the same. So in other words, they can't discriminate in mental health, which addiction falls under, and treat that as a lesser program than they do medical health. So that's something that people need to understand. Maybe take a look at your state and see how compliant they are, and if you're on Obamacare, making sure that they do the right thing and they're complying with the law. So one thing that people don't get is, where do I start? Like I know I need treatment, I need detox, I want to go to a stabilization program. I may be interested in a day type program, intensive outpatient. How do I go find these things? And how do I kind of pare down? There are over 14,000 treatment programs in the United States. How do I pare that down to find what is right for me, what I can afford, and what will give me the result that I'm looking for? Where do they go?
Yeah, great question. First place most people go is Google. And when you do that search, you get hit with a lot of ads and a lot of fancy SEO tactics where their search engine, helps them pop up. I say still make those calls because there's an opportunity to listen to what it is that they provide, so that when you're looking at other options, you can weigh that against it. And I think that focusing on someone who's going to sell you more on how they're going to help your family and your loved one get to that long-term success, rather than, hey, we've got a great pool, we've got X number of acres, we're in this beautiful environment. But if they're really focusing on what's going to be the end result, I think that's that. And the other thing is, you can go to findtreatment.gov, which is the federal listing from the federal government, to where you can look by your location, you can look by level of care, you can look by types of insurances accepted, you can do that kind of thing too, and compare that, because you might have some other fantastic options that just aren't spending the money to have ads on Google.
Yeah, one thing also, I'll give you an additional place that people can start. On Pathroot, if you sign up for a membership and you go into your dashboard, there's a link to click called resources. And on that page, there is a link over to a really good kind of screener database that was produced by Safe Project in partnership with the Partnership to End Addiction, drugfree.org. And it does a lot of the same thing. It asks you a lot of questions. Where are you? Who are you? What are your demographics? What can you afford? What are you looking for? And then it'll narrow down the scope of what's available in your geography, in your price range, and for the type of program that you're looking for. The other thing that people need to be really conscious of is asking the right questions of the admissions counselor when you're thinking about a program. So I'll just give you one, and then I'll bat to you for other ones. Are they doing mental health work with coexisting challenges? So in addition to addiction, you might be experiencing anxiety, depression, PTSD, other bipolar disease. You might have other complications, and you can't fix one without fixing the other. So what kind of questions should you ask an admissions counselor before you make that commit to enroll your person?
Yeah, those are great. Absolutely, that's necessary to take a look at co-occurring disorders. And I think a lot of places do a better job of incorporating more treatments for that. And some might be both substance use primary and mental health primary, and offer both kind of components. Um, I think that along with that is going back to, a lot of times when people come into a new treatment, if they don't know, let's say if they need medications, for example, if they don't have enough of the history and what has worked and not worked, and previous medical records and previous attempts at other facilities and things like that, then it's harder for them to make a really good determination until somebody gets there, and then they're there, and then they have to start from scratch. Like, who is this person? What is their background? And they start to take a best guess clinically. So the more information that you can provide to them as possible helps them do their job better, and also making sure that they're going to involve you in that entire process and make that a requirement for admission. Honestly, because even though an adult child or a spouse or something like that, they can at the end of the day decide not to sign that release of information. There's definitely ways to help them come to the conclusion that it's necessary. And I think that really circles back around to why you exist, is that the family is so important.
So why don't both of us end this live stream? I'll start with you. If you could give families one piece of advice when it comes to treatment, what would you tell them?
Just that the residential stay is just for stabilization, that focus on the long-term support methods and systems when they get home, and shoot for that 12-month long process, ideally.
And my piece of advice would be similar to yours, that addiction is a disease that requires maintenance and management over the long term. And you will get a bad outcome if you pick the wrong treatment, if the family is not educated and involved, and you don't understand the recovery process and your role in it. So thank you for joining us on our live stream with Luke Caton, the CEO of Innovia Behavioral Health. and join us for live streams in the future. We have them every Wednesday at 1 o'clock Eastern. So thanks again, Luke.
Thank you, Carolyn. I appreciate it very much.
All right, bye-bye.